So today is the 27th of February 2013, and we are in the Jikmar hospital in Pondicherry with Ananda Balayogi Bhavanani, who is a yogi and also a medical doctor. And so namaste, Ananda. And so you have devoted quite some of your time in building bridges between yoga and medicine on a research level and also on a yoga therapy level. And by doing this, actually you're following the footsteps of your father, who Swami Gitananda, who already did this actually like in the 70s. There was already a collaboration between the International Center for Yoga Education and Research and the Jikmar Hospital. So what I would like to discuss with you or get your insights from you today is why this dialogue between two seemingly very different things, like yoga, which is more like a traditional spiritual path of maybe self-discovery, and on the other hand, like a modern science who wants to treat illnesses. So why this dialogue? And what are for you the stakes and the challenges, maybe the difficulties, or what to learn from it? So we're ready to listen.
Yeah. Actually, when we think about health, we need to understand that health is not just the World Health Organization's definition of a state of well-being at physical, emotional, social, spiritual levels, but that actually health is a very dynamic state of being, not just a state of being, but it's dynamic. Now, if a person is interested in the health of others, if a person is interested in the well-being of others, something which is called arogya, which means the absence of disease, arogya. If someone is looking at swasth, which means again health, well-being, as opposed to arogya, which was absence of disease, which is similar to the modern definition. Swasth, which is the ancient Indian definition, looks at health as balance, harmony, a sense of well-being at all levels of existence, but that this is dynamic. It is not that you attain to a state of health and then you are going to be there forever. It is that, one day you're going to be up, one day down, and how do we balance, how do we regain our balance is what health is all about. So now, modern medicine is trying to give the people a sense of health, but in trying to do so, we are missing the bigger picture. Because modern medicine has looked at the human being as multiple systems: your cardiorespiratory system, your excretory system, your nervous system, your endocrine system. The systems are broken down into the various organs that make up the system: the stomach, the kidney, the lungs, the brain. These are broken down into different tissues, and these tissues basically are again the nervous tissue, the connective tissue, the epithelial lining. And then that is broken down into the cellular level, which then modern science takes even further into the subcellular particles, atomic, subatomic particles. So it is as if the human being is being perceived through a microscope. Breakdown study, breaking down the complete integration into pieces, in trying to understand the whole. Now we must remember that the whole is always more than the sum of the components. But modern science has tried to understand, especially medical science, all the individual bits of the human organism, and then we say we'll put it all together and we get what the human being is. So it is a microscopic breakdown perspective. Now the perspective of yoga is you are not just the body, which is the Annamaya Kosha, the physical body, the anatomical level of existence where you have your limbs. You are not just that, you have energy, you have life, which is prana. So you have the Pranamaya Kosha, which for me is the physiological level of existence. So anatomical existence is having a hand, having a brain. Physiological is now using it. It is functioning. But then even machines function. They have parts and they function. So then what makes the human being special? The concept of mind, which is then the manomaya kosha, the psychological level of existence where we are thinking. That is then taken to a new level when we move from just being human to, you could call it superhuman, you could call it man to superman, you could call it conscious to superconscious, you could use different terms. Moving into a higher intellectual ability where one starts to question about life, questions one's role, the universe. And this becomes the Vijnanamaya Kosha, and then we understand our link with the cosmos, the Anandamaya Kosha, where now it is our cosmic level, universal level of existence. So the yogic perspective of the human being is one of a build-up, telescopic view, as if you are trying to understand the whole universe through a telescope. Whereas the modern medicine is looking at the human being through a microscope. So one is the breakdown study, one is the build-up study. And though they seem to be very different than each other, they are in fact two sides of the same coin. They are in fact two eyes that we perceive someone and we get dimension. If I look just through my right eye, what I see is one thing, it has a single dimension. When I look through the other, it has another dimension. And when I put them both together, I get the third dimension, depth perception. So when we combine, when we build a bridge between yoga and modern science, be it research, be it therapy, be it just knowledge, the moment we build this bridge, we are gaining a depth perception. We are starting to understand a new dimension of the human being itself. Now, if we understand the human being, we start to understand what is the working of the human being. Why is it that certain people can get from birth to death with seemingly normal health? And why is it that some people don't survive more than a month in the body? Why is it that somebody who's normal up to 40 suddenly develops diabetes? Why is it that somebody who was, normal till 80 dies and they do post-mortem and they find they had 25 different disorders, yet they lived a normal life? So, these questions start to come to mind in our search for health, in our search for well-being. And through research, what we are trying to do is we are trying to understand what are the mechanisms, what is the biophysical mechanism, the psychophysiological mechanism, the psychosomatic mechanisms by which yoga can help prevent disease if it has not occurred, the way yoga can restore a semblance of normalcy if disease has occurred, and even if disease has gone too far, how we can try to minimize the use of medication or other assistance. So preventive, control, management, and rehabilitative. I would say there are three aspects that we can deal with here, be it therapy or be it research. Now, the essence of all disorders according to the yogic philosophy is basically the mind. And something that is slightly beyond the mind, which is called the Adi. Adi is the start, it is sort of the psychic nidus that sets off the psychosomatic. What's happening?
I think it's outside somewhere.
Something rolling around. So when we talk about the health and disease from a yogic perspective, we understand that all disease starts in mind or something above mind, the psyche, where the nidus of disease is set into motion. The ball gets into motion, it starts to roll. Now, this concept of Adi is where it starts. Now, if you look at the koshas which we were discussing, the Pancha Kosha, Annamaya, which is the physical, Pranamaya, the energy, Manomaya, the mind, Vijnanamaya, the intellect, and Anandamaya, the cosmos. Basically, Swamiji, my father Swami Gitananda, has said that the last two, the Anandamaya and the Vijnanamaya, cannot really be disturbed much. But then it's these lower three that sort of get into play, a concept he is called Nara, which is psychic disassociation, where the mind, body, emotions are not where they should be. They are not fitting. So this Adi which starts percolates down into the Manomaya Kosha level, that is the mind, where we have agitations of the mind, we get depressed, we get anxious, there are all these, a mood off, there is a paranoia, fear, tension, all this starts. This percolates down into the energy sheath, the pranamaya, where now the energy is being agitated. The nadis, the psychic nerve channels that conduct the conduits for the energy, they are sort of not able to tolerate the energy flow. There is something happening. This then comes down into the physical body, where through especially the digestive system, all Indian systems of medicine look at the digestive system as the root sort of point where all disease enters the body. And there is either the digestive system goes down or goes haywire, or there's some malfunctioning, and then the body starts to develop disease. Now this can be said to be in 4 phases. 1, the psychic phase, where it is just the mental jitteriness. Psychosomatic, where now in the body your blood pressure starts to rise, your heart rate goes faster, your blood sugar, your biochemical parameters will be taken off normal. These two are more temporary, psychic and psychosomatic. You can deal with it, give a bit of relaxation, and people can get back. But then the third stage is somatic, where this has stayed long enough, it starts to take up permanent resistance in the organs. And now what is happening is that the permanent hypertension, permanent diabetes, permanent asthma is starting to manifest. And if this is not controlled by any means, it ends up in the final stage, which is the organic stage, which in medicine we call the target organ damage. Someone who has diabetes or hypertension, the eyes, the kidney, the heart are the target organs that can end up being damaged. So the yogic concept of psychic, psychosomatic, somatic, and finally organic, along with the concept of Adi, the mind and above being the causative agent of the Vyadi, disease in the body, these enable us to understand that it is not just the bacteria and the germs, the viruses that cause disease. That modern medicine has now understood the psychosomatic basis of disease, but it's only been the last 100 years. Before that, if a doctor talked about the mind causing disease in the body, they would have a lot of trouble. It would not be accepted as science. Today we understand mind-body medicine. Now yoga is the original mind-body medicine, because yoga understands the principle of the mind, the higher, affecting the lower, the body, but then also understands through the body you can influence the mind. When you posture, when you adopt a posture which is an asana, what you are doing is you are posturing a certain somatopsychic effect which goes the other way. Through the yogic kriyas, you are working on channelizing the process of purification at physical, mental, emotional, spiritual levels. And that is why the Shat Karmas, the cleansing actions of yoga, and the concept of Kriya Yoga as in Patanjali's Yoga Sutra, where Tapas, Swadhyaya, Ishvara Pranidhana, discipline, introspectional self-analysis, and giving over to the higher, these are all processes of purification, and they enable us to move from a state of disease, illness, unhealthiness, to a state of ease, health, healthiness. Now, when we started to research this over the last couple of decades, One of the first studies was by Swamiji along with Dr. Madan Mohan in Jipma, which looked at Savitri Pranayama in Shavasana, and how the adoption of Savitri Pranayama in Shavasana brings down the oxygen consumption, which is an index of the way the person is relaxing, and ultimately tells us that the person attains a state of relaxation that is much deeper than obtained by sleep. And this is one of the very important qualities that these studies give us. They give us a hint that, okay, where can we compare?
I would have one question
Yes.
on this. India is a quite interesting place in the sense that actually, like when the first college of medicine was
Yes.
established, like end of the 19th century, almost a couple of years later, the first university or college of Ayurveda was also established. So even on the, let's say, official or modern institutionalized level,
Yes.
you have a coexistence. And then when independence came, you had a recognition
Yes.
of the traditional Indian systems of
Yes.
medicine, like Ayurveda, Siddha, Unani. And you have now the ministry, Ayush. And
Yes.
so yoga and homeopathy are also part of it.
Yoga, basically it has Ayurveda, Unani, Siddha, Yoga, Naturopathy and Homeopathy, all under one. They used to call it the Indian systems of medicine and homeopathy. Now they just call it Ayush. And interestingly, the term Ayush means life. So it's now this coexistence.
So it's very interesting because you don't have this in all the countries. You know, this like
Yes.
really official recognition of the modern medicine on the one hand,
Yes.
but also of the traditional medical systems on the other hand. But the question which arises, it is still the traditional systems which have been put in the framework of the
Yes.
modern system.
Very much.
And I had a long discussion with Darshan Shankar from the Foundation of the Revitalization of Local Health Traditions in Bangalore,
Yes.
who, as you also pointed out, said that the traditional approaches are more, let's say, holistic,
Yes.
and the other one are more reductionist.
Absolutely.
And so when you try to understand one from the point of view of the other, there is some problems.
Yes. Yes.
And I remember having read like an old article by Swamiji,
Yes.
where he had found that at some point they wanted to study the effects of Shirshasana,
Yes.
and they did it with rats, you know, that
Yes,
they put
yes,
on their
yeah.
heads because that was like objective science with no subjective elements and so
Yeah,
on.
and also they couldn't get yoga subjects.
That's it.
People who could do that.
So my
Okay.
question would be, so it's very interesting. So
Yes.
we understand now what the aim is of doing
Yes.
this yoga and medicine dialogue, but there seems to be also some, let's say, problems of dialogue. You know, of
Very
how do
much.
you design research standards or
Yes.
projects? Or
Yes.
so what could you tell us about this?
I would say that one has to be careful because in trying to research yoga using the modern paradigm, what we end up doing is that we are trying to then put yoga in a box. Because modern science knows how to research when something's in a box. They don't know how to research when it's out of the box. So what we do when we want to research yoga, we are putting yoga in the box. And by doing so, we are limiting yoga. The only plus point I would say in this whole thing from my own experience and what I have seen is that as in the study with Savitri Pranayama or we have done on Pranava Pranayama and other techniques, you start to get a glimpse of one effect of the technique or one effect of yoga, which then sort of enables the modern scientists to say, okay, fine, this is also science in our eyes. It sort of validates it. Now the thing is, we should not stop that yoga, the effect of yoga is only that much. For example, Shavasana is a very good relaxer. When you do Shavasana, the blood pressure, the heart rate comes down. There is decreased oxygen consumption, peripheral blood flow improves. So we say, wow, Shavasana is very good for relaxation, and Shavasana will be very good for hypertensive patients. Okay? This is how modern science looks at it. Now we must realize that just as the iceberg just has 10% above the water, what we are perceiving and recording through modern scientific methods is still only 10%, and I'm being very kind, 10% of what, say, Shavasana is doing. Because Shavasana is about an attitude of renunciation, an attitude of relaxation, and the psychosomatic, psycho-spiritual benefits that are occurring are so big that just the one bit of it It's like the little finger of the whole human being we are perceiving through modern science. But it is easy to say, okay, then why should we do research? I take the approach that we should do research to know the little finger, then maybe you start to know the other fingers, slowly develop equipment, methods, models that can start to look at the bigger picture of yoga. But if we say no, we are not going to research it, we are shutting out one entire eye. And even if one eye is not able to see much, it is still giving us a new dimension. So research is absolutely essential. Question is, where's the money for it? For a pharmaceutical trial, I can get thousands of euros. For a yoga trial, 100 rupees is difficult. So then if I cannot pay my subjects, if I cannot even pay them the bus fare to come for the study, they're not going to come. And then we say there's no compliance. Oh, you only had 20 subjects in your study. Yeah, because yoga takes discipline, yoga takes effort. And if I want to do a study, that is why K.N. Udupa, who did the study you were mentioning of rats in test tube, he couldn't get people to study. And he said, what can I do? Better study rats doing the headstand. And sometimes you do get that feeling because you need the funding, you need the energy. But now I will say that things are much better, at least in India. We are getting funding, the government is setting up yoga research centers. There is now the Vyasa Yoga University which is doing, Swami Ramdev has started his Patanjali Vidyapeeth which is doing research. But still it is very much in the infancy. And there are a lot of teething problems. Because in this craze for research, validation, we end up saying Shavasana is only good for hypertensives. And what happens is we label it and then we put it into a corner. Forgetting that everybody can do Shavasana. And the effect of Shavasana in different type of people will be different. And in fact, we did a study on that. We did a study where normally it is said right nostril breathing, if you close your left nostril and do right nostril, increases heart rate and blood pressure. Now we did it in people who have hypertension and showed it doesn't. So see, the technique which causes a rise in a normal healthy volunteer doesn't do it when a person already has a higher blood pressure. So the technique has a built-in safety mechanism. And now we are starting to know that. But otherwise, it's very easy to say, okay, this technique has this effect in normal subjects. But then does it have it in patients? Because we are not doing it in patients, we are just using the normal subject model and saying, yeah, because this is working in normal subject, you can apply it. But then nobody's doing that second part.
Yes, and you bring up another very interesting point, which is that probably traditionally, you were starting to practice yoga and you were in perfect physical, mental, and everything, right? And now it's very much used as a therapy, like yoga chikitsa, yoga therapy. Yes. And so you're pointing to this. So traditionally, these questions maybe were not even there, because that was not the question.
That was not the reason people took up yoga. Now, the only thing what I would say is that yoga has something for everyone. And so, if someone is not well, yoga can help them get back to a semblance of normalcy. Now, so it is not that, you only have to be healthy to do yoga. It would be preferable. And then yoga would work in a certain method. But then when someone's not healthy, yoga adapts something, some safety mechanism that will not harm the person. And that is why this modern concept that, yoga may be dangerous. The only way yoga would be dangerous is if someone is being really careless about what they are doing. Because with the proper guidance, I do not see how yoga could be dangerous under proper guidance in the proper way. But you have people who want to, they want to jump to the 108th step before starting the first step. Then there can be issues. But then, at the logic people are using, walking down the stairs is also dangerous. Brushing your teeth can be dangerous because, you may swallow the toothbrush. And that the logic is like quite far-fetched. So coming back, what is happening is that we don't have enough research to tell us what is actually happening in the different techniques, because nobody really wants to fund that. But then what suddenly has come into sort of popular demand is yoga for different health conditions, which different organizations and the government are willing to fund. So now you want to study yoga in diabetes, yoga in hypertension, yoga in AIDS, yoga in cancer, but you don't really know what these techniques are actually doing. And so we take 20 techniques and we study it, and we say yes, after 6 months there was a benefit. Now which of the techniques was giving the help? What technique was working with what? We have no idea. But we just know there's this package. And who creates the package? It's the whim and fancy of the researcher. So someone has put together 10 different techniques and they are studying that for cancer. Now naturally yoga will help everyone. So they find something positive and you say, oh, this is the yoga schedule for cancer. And it's not. Someone can do a whole set of another group of techniques and get the same effect, because it's yoga as a whole producing the effect. So what I think we need when we understand yoga and try to research it is, one is not to put it in the box. Now there are points you have to put it in the box initially, but to know that yes, I am putting it in the box. And now this is what we have done. We have found Shavasana does this. We have found this pranayama does this. Surya Namaskara does this. But then let's take it out of the box. What else is happening? Is there some qualitative changes occurring? Now when it comes to qualitative changes, the research becomes even more difficult, because you give a person a questionnaire and now that person doesn't want to write what's the truth, because they don't want, they think that maybe you will not like it. So then how do you get an honest questionnaire filled up by someone? How do you get, and again, how much does the person really know even what they are feeling to answer a questionnaire? We are taking for granted that someone is already conscious, aware, knows themselves when they answer the questionnaire. Most people struggle, to know anything more than say the name, age and where they are. And then we say, yeah, okay, they are fit to answer the questionnaire. And they may not they may not understand the question, and they don't want to ask you because they don't want to feel, they don't want you to think they don't know. And so, okay, I'm going to fill it up. And then we come up with this beautiful study and we say, I did this psychological questionnaire in 222 people and this is what I got. So, the basic premises on which we are basing research, one has to be very careful. And personally, I feel that we have not even looked at 0.1% of the effects of yoga in all the research done till now. And yet you have people who think that, oh, we now know scientifically everything about yoga. Because they know scientifically everything about yoga in the box. But yoga is not in the box. And it is like saying that, I'm going to lock you up in this room and study you for 10 years and I'll know everything about you. I'm not going to know anything about you, because only when I put the human being out in society, when I put the human being in different situations, that then the human being manifests. So putting a human being inside a lab and saying I know everything about the human being, you just start to know, you just start to get a glimpse. But the glimpse is important, because you were talking about the Indian systems of medicine. Now it is quite pathetic that in the same university which has a medical college and next to it has a Ayurveda college, there is no interaction between the modern medical college and the Ayurveda college at all. So then both are existing side by side, but there is no interaction. Because the guys here say you are a pseudoscience, those guys say no, we are the original science and you don't know. And the fanaticism on both sides blocks it. So bridges are very essential, but these are bridges which are not concepts. These are not bridges which are government says you guys sit and talk. You need human bridges. You need human bridges who are going to be able to understand both the systems and then try to work to bring them together. Because if you have someone trained in Ayurveda and then tries to learn about modern medicine, his perspective is going to be very different. Someone who's trained in modern medicine looks at Ayurveda or yoga, their perspective is going to be very different. Because the modern medical doctors are trained in a certain way. they are conditioned in a certain way. That when they look at yoga, when they look at the Indian systems, they put them into that same framework. When yoga, all the Ayurveda people look at that, they are looking at it in a different way. So you need people who can have both the perspectives, both the eyes. And it's very difficult. You don't find many. And this is something which I have found in my life, that be it research, be it therapy, one needs to be open to the other perspective. And this I always say that when we do the Brahma Mudra in yoga, the 4 different directions, I say the idea of Brahma Mudra is not just neck health, it is not just the sound vibration A, O, E, that helps you bring health. It is not just a sense of relaxation, but it is that it develops ability to look at different perspectives and come to a balanced view. Each time you go away, you come back. 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 But ultimately, you are coming to one perspective that takes into view all these perspectives. And that is what we need. Now when that happens, we will start to understand what yoga does in medical terms, in scientific terms. And we'll start to understand science through the yogic perspective, which is very beautiful. Because the yogic perspective of science gives an expansion to the science. Modern medical science has become so much of a science, they have forgotten the art part. And I say the art part is forgotten and the heart part is forgotten. Because a doctor, when they deal with a patient, it is not just a diagnosis you are dealing with. It is not just a lab report you are dealing with. You are dealing with a human being. How to deal with a human being is the art part, which comes from the heart. The tests, the diagnosis, the treatment may come from here, the head part. But you need this bridge between the heart and the head, even for modern medical science. And what has happened is this influx of modern medical sort of attitudes into yoga. We are now starting to have courses, specialist in yoga therapy for diabetes, specialist in yoga therapy for heart disorders, specialist in yoga therapy for brain disorders. Now imagine that what we have done is, we have taken the reductionist attitude, that microscopic attitude, and just put it on yoga and said, okay, this person will only be qualified to teach these 20 techniques for a cancer patient. Where's the yoga there?
So what would be your experience, like you make a nice transition actually, like from the more research part now to the applied part, here, like what you're doing in Jitma, because there is this department like of yoga therapy. So how do you fit in? I mean, how does it work? How does your...
we have been very lucky in that way. We have been very lucky that there have been some enlightened people at the top of the government in the health ministry who have started such centers, bringing centers for yoga into allopathic modern medical institutions, which are premier institutions. Now, what this does is that it enables the medical fraternity to see that yoga can also coexist. It's a very beautiful, I think the success is about the fact that it has happened, and we have had so many of the doctors come for the yoga. Now see, when a doctor comes for the yoga and they start to practice the yoga, they start to realize the benefits, they start to trust it a bit more, they open to it, you start to create a beautiful bridge. And in fact, our medical council in India has now said that first year medical students should have a certain amount of exposure to yoga, which is very beautiful because the Chinese doctors always had that exposure to Chinese medicine, whereas Indian allopathic doctors do not get exposed to Indian systems. So I'm very happy that's happening. So here we have the advantage that the doctors, the nurses, the physiotherapists, they get exposed to yoga. They start to then tell the patients, maybe you can do yoga in addition to your medical management. Now when a patient in the Indian context is told by a doctor that maybe you can do yoga, you have already created an opportunity for that person to get better through yoga. Now what I find is that here we are very clear in our limits. We say that, okay, fine, if someone says, I'm going to have a kidney transplant next week, and can you teach me yoga to prevent that? I'm going to say, sorry, it's not possible. We need to be realistic. Because there are many people who are like, oh, I will cure everything under the sun with yoga. Now see, the moment you do that, you are creating a rebound effect in the scientific community which says, oh, this is a pseudoscience, this is a bogus. Look at what he said. And I get questions from fellow doctors who say, your fellow yogis are saying this. What do you think? And then I'm stuck. I say, I'm sorry. Because this is where one has to be very careful. So what we try to do in this center, and I have personally tried to do it in my own life, is that understand the limitations of yoga as a therapy. And say that there are points where you need other help and the yoga can work with it. So if someone comes with diabetes who's already on treatment for 5 years, I don't say stop the treatment and start yoga. I say that continue the treatment, start the yoga, let us see how the changes occur. Now in some of them, they can reduce the medication. In some of them, they get off the medication. Very rare individuals. They are really dedicated people. We have a lady who's like that, who was on insulin, shifted to oral drugs and is now off the drugs with normal control. Touch wood, last 3 years. Now, it is possible, but not every patient is going to have that. So, what is the patient's need? How does yoga fit into their lifestyle? How does yoga fit into their medical management? This then becomes that bridge. And we have seen about 32,000 patients in the last 3.5, 4 years. And I will say that most of them have had very good benefits. We have documented it, we have published papers, there are 24 papers published, including yesterday we published one paper on different findings we have done here. And so we are documenting it so that the medical fraternity can understand. They say, yes, yoga is a science. Now they may not yet understand the art part of yoga, but at least the science, they'll say, yes, it does fit in. The yoga practices along with the medical management enhance the quality of health care for the patients. They reduce the cost of health care. Now the moment you say quality is increasing, cost is decreasing, you have a win-win situation. And then you say, okay, yes, but then the pharmaceutical industry will not like that. Well, I will say, pharmaceutical industry should never be afraid of yoga as a threat, because yoga takes too much discipline. And people just don't have it. So, we had a patient who had thyroid problems. She is now normal with the yoga. Her friends wanted to learn the techniques. After 4 days, they said, I'm sorry, it's easier to pop a pill of L-toxin in the morning than to do 40 minutes of yoga every day. So, the pharmaceutical industry should not really be worried about yoga. This is my own personal feel. They should in fact support yoga, because it will show a good heart of them. It will show the good heart if they actually start funding yoga research. Because it takes too much discipline. And how many people can follow the lifestyle? Because yoga, again, it's not just the technique, it's the lifestyle, it's the attitude. What attitude are you going to take towards that which stresses you? Life is filled with stresses. And stress is basically what this Adi Vyadi, I was telling you, the highest, the mind, and above and coming down as disease in the body. This can be understood in modern scientific terms as the stress leading to disease. And there's this entire mechanism how stress comes into the body and leads to disease. Now there are going to be stresses, workplace, home, society, the road. Even in caves there are going to be stresses, because there will be a lizard, there may be a snake in the cave. So even a cave is going to have it. The top of the mountain is going to be cold. That may be a stressor. So the moment you perceive something as stressful, the stress reaction kicks off. So the key lies in not perceiving something as stressful. Now, this is very difficult. Easy to say. It is like, you have thorns every place. You just put on a pair of slippers and you can walk around. See, the thing is that this perspective towards life itself becomes the key attitude in dealing with stress disorders, which are psychosomatic, Adija Vyadi, again it's all the same. So attitude becomes the key element of yoga as a therapy. Now how do you develop this attitude? How do you measure this attitude? How do you inculcate it in a person who is suffering from diabetes or asthma or cancer? But if you can get this, and this is where the concept of yogic counseling is so vital in yoga therapy, and most people don't do it. So if someone comes and says, I have hypertension, I say, do this pranayama. I have cancer, do that asana. It is not yoga therapy anymore. It's not yoga chikitsa. And that is why I call it yogopathy. Just as allopathy, homeopathy, how we have all these boxes, I say similarly we have yogopathy, where one asana or one technique for one disease. And we are limiting yoga into the box. And usually yogopathy will be like based on scientific research. Because you are limited, so only thing you know is what has been researched. It's called evidence-based medicine. So we are calling it evidence-based yoga therapy. But that's yogopathy. Now yogopathy will be useful. Someone has diabetes, they do left nostril breathing, it will help them. Someone has hypertension, they do Savitri Pranayama and Shavasana, it will help them. But it is not looking at the bigger picture. Where is the change in attitude? Where is the change in lifestyle? Because if a person doesn't change their attitude and lifestyle, no matter of doing any number of asanas is going to have a permanent cure. It's not going to do it. You may have temporary benefits, you may have that tip of the iceberg, but that 90% below the iceberg, in the case of yoga I say it is the 90% that is non-physical, the metaphysical 90% as opposed to the physical 10%. That metaphysical aspect is not going to happen unless attitude, lifestyle, which includes diet, how you relax, how you work, how you eat, how you sleep, these are all part of lifestyle. And this yogic lifestyle, how do you bring it into people? How do you inculcate? How do you make sure that they follow it? How do you motivate them to follow it? And that is where it becomes difficult. It's not an easy fix. And
so maybe I would like ask you, because our hour starts to be almost like
yes.
over, so these last points that you are developing, the importance of attitude and like of a lifestyle. So there is yoga lifestyle,
yes.
yogic attitude, but I would like to ask like more specifically. You talked about it, like this thing of listening to the other perspectives.
Yes.
What did this path, I would say, between yoga and modern science, what did it bring to you, like personally, like in your, what did you learn
yes.
from it, or
yes.
how did it nourish you? Because you're still doing it, so there must be something. And the second question, what would be the things that you like to share, or advice, or inspiration, that you would like to give to yogis or to doctors, to maybe convince them, or just give them some taste of saying, oh, it may
yes.
be interesting. I also want to taste that kind of experience.
Now you see, for me, what modern medical training has given me from the yogic perspective is it has given me a very good common sense approach. It has given me a very good logical, systematic approach to the yoga, which I really feel blessed to have that, because the modern scientific training makes you understand a systematic approach to anything. So a systematic approach, it has given me the tools to understand the yogic experience and to sort of give terms for what we are having in yoga. So it has helped enhance, I don't want to say it has enhanced the scientific quality of yoga for me, but it has helped me explain yoga in a more scientifically, logically, systematically understandable manner. And also look at it, a new perspective to analyze it. Especially the cause-effect relationship. Now, what yoga has given me as a doctor is that it has enabled me to understand just prescribing a pill is not enough. That holding someone's hand may be more important than prescribing the pill. Talking to someone, listening to someone may be more important than an injection. Understanding the root cause of a person's issues may be more important than just a symptomatic treatment. So the yoga has given me that. So I will say that yoga has enhanced my perspective of medicine, especially of the art of medicine, the art and the heart of medicine, which I perceive very strongly. And this is thanks to the yogic training. And the yoga has given me maybe the head approach to, the medical training has given the head approach to the yoga, which has made clear many things which for many people are very confusing. And this is one of the things that most people find, is that I'm able to explain some of these complex yogic concepts in a simple way, and I attribute the medical training to give me that. Now, a message to young doctors, well, we must realize that we don't have the cure for everything. And second thing, we have to know that we don't know everything about the human being. We don't know everything about the human being, we don't know everything about disease, we don't know everything about cause-effect. Most of the etiology is still unclear, idiopathic. So why not take the tools that are there in other systems of medicine, use them in an integrated fashion with our system to enhance the quality of healthcare and the beneficial effects to any patient who comes to us. So I think the doctors, the modern doctors, by understanding, joining the other systems with them, creating an integrated system of medicine, can enhance the benefits our patients get. Rather than saying, I know the way, and even if you die, you should die using my medical treatment. That I want you to live, I want you to be the best you can. If it is through modern medicine, well and good. If it is yoga, if it is siddha, if it is a combination of them, well and good. That openness. And for the yogis, I think my message is, again, do not try to hide behind the curtain of the, this is not physical and so you won't understand, and you have to be enlightened to understand. There's a lot of this coming in, and let us be a bit more down to earth. Let us be a bit more open, that maybe we can enhance our understanding of this grand science of yoga using the tools, the torch lights, the LED lights of modern science. Maybe we can look into the dark corners and find more of our own system. So I think there's a message for both. And if two hands come together, they can clap very well, rather than one hand trying to clap on its own.
So thank you, Ananda, for these nice and good inspirations that I hope will inspire lots of people to not only think about it, but actually start to put into practice this kind of.
I'll be very happy for that to happen.
Thank you.